Hey, this is Elon. Welcome back to the Holistic Health Podcast. And today I'm joined by Dr. Louise Fitzgerald. And Louise is a GP in Grafton Medical, where she is passionate about empowering individuals to take control of their health through education and information. She is clinical lead in menopause and occupational health, which means work-related health, and runs her menopause clinic in Grafton Street. She is also the clinical lead for the newly launched menopause clinic in the Evoca Clinic in Carrickmines. Louise, how are things going with you today?
Great. Thanks for having me on. I'm delighted to be on today with you. So that's brilliant.
Yeah,
Um,
thanks so
Good
much
day.
for joining.
No, busy day after the bank holiday weekend. I'm sure yourself as well.
Yeah, it's so nice to have the weekend off, and it's been lovely and sunny here in Ireland the last few days, so it's been
Yeah, it's been
great
great.
to enjoy it.
I was, I was doing a menopause clinic on Saturday, and I thought there'd be no one in it because I thought with the bank holiday weekend no one would want to show up. But actually, it was fully packed. So we were there the full day. So it was great.
Amazing, good stuff. Where was that on?
That was in Avoca. I do Avoca Saturday clinics, and then kind of some Fridays as well.
Wow.
Um, just to have like the opportunity for, because I find sometimes women pack their health into hours that don't really exist within the week.
Hmm.
So just having that opportunity, I think we associate healthcare on Saturdays and Sundays with emergencies only, but I
Yeah.
think it's good to have like the option there for women to be able to go along on a Saturday and be seen.
Yeah, no, that's amazing. Absolutely. And that's, there's so many different topics I want to go through with you today. Probably more than we'll even be able to cover in the next like 45 minutes to an hour. But it'd be great to go through a lot of the really important topics, around like you mentioned there, self-care and menopause and perimenopause and maybe misconceptions around menopause and, working with a doctor who is knowledgeable about it. And there's so many things that we can go into, but it's really interesting that you bring that up about having the practice in the clinic on a Saturday, because that's what I've noticed with a lot of women that I work with. They tend to be literally at the bottom of the priority list. Everything else comes before their own self-care. It's like work and their kids and taking care of things at home, and maybe their partner is busy working, or so many different things that they're juggling, and then their health always tends to go by the wayside because you can only juggle so many things at once, right? So it's interesting that you're
Yeah.
seeing that in your clinic as well, that a lot of people there can only make it on a Saturday or things like that.
Yeah, and I think part of the problem with that is that you can do that for so long, and then either you burn out doing that because it affects you mentally and physically, or then you maybe, miss something that's really important actually, and then affects your health in a big way. And then you're trying to sort of scramble to catch up because actually you have to do something about your health now in a big way, but you've
Mm.
still got all those demands going on around you.
Yeah.
Um, I think, like I remember I saw a cartoon character of, your average female in their 40s and 50s, and it's like people are hanging out of them, that they're holding a briefcase, a work briefcase, and they have kids hanging out of them, and then they're like holding up their, elderly relative and trying to, nurse them along. And it's just that whole like everything's dragging out of you. I think what I see, and you probably see this with women going to see you, and a lot of women, I often say to them, look, we'll do a consultation, we'll figure things out, we'll come up with a plan. And then if you don't want to keep seeing me because you want to be following up with your GP, because I think GPs are really important for people, maybe we can, now or eventually discharge you back to your GP and, and continue with them. But a lot of them will say, actually, I just want to keep seeing you because it's like the space I need and the person that just listens to me and gives me that time and space. Whereas
Yeah.
maybe because I do longer consultations, they don't tend to get that maybe with their own family doctor. And it's just like that. It's like all those things that are weighing them down just kind of like are taken away or fall away for that half an hour consultation where they get to talk to somebody.
Yeah, absolutely. Because in terms of people that I've worked with to help them with their fitness and strength, and clients on my side of things, I've worked with a few people who are doctors as well, and
Oh,
they've
yeah.
shared with me that the whole medical system, I'm not sure about other countries, but especially in Ireland, it feels like very rushed for a lot of patients. It's literally like 15-minute time slots, and you can only fit so much stuff into 15 minutes. So it must be like very difficult both for doctors and patients if you've only got that short amount of time, to try and to get everything in and to listen to someone's needs and like you said, hold space for someone, especially if they've been struggling with burnout or whatever it is that's been happening for them.
Yeah, and I think what happens is you just abandon the sort of chatting to them and listening to them aspect, which is like so important. But I think you end up kind of abandoning that for just trying to get things done. But that aspect is so important. And then I think as well, you sort of abandon the preventative side of things. You just deal with what's in front of you when actually you should be thinking, okay, what's in front of me and how does that apply to the bigger picture? And what is the bigger picture here? How do I see their health going forward?
Yeah, absolutely. And that's why, I really like everything that you do and your ethos because it is that like you're looking at it from a preventative
Mhm.
standpoint and how is what we do now going to affect someone's health in the long run? Because I'm sure, and I don't know, maybe this would be a good question to ask actually. So in your opinion, do you think maybe some doctors are more about disease management than they are necessarily about preventative medicine, or what have you seen kind of like in the industry?
I think it depends on maybe on your practice a little bit where you're based. I probably have a bit more luxury here in that I'm in a sort of city center practice. A lot of
Yeah.
people are really well educated on health. They might have some health insurance. So they'll come in a bit more frequently or they'll come in just looking for sort of health checks. And so I have the sort of more luxury, or I can say to people, come back again and see me and we'll do this. Whereas in some practices, maybe, they don't have, they're really busy with patients with lots of chronic diseases or don't have, the sort of the finances to keep going back to the GP to do bits and pieces, or maybe to go to a clinic and get a lot of the cardiac screening I find is quite private, and so like if you have private health insurance, you can get that done, but if you don't have private health insurance, that those options aren't really there for you so much. So I'm probably very lucky where I work as well that I'm able to sort of take that approach. I think
Mhm.
it probably is harder in a big sort of medical card practice where maybe people don't have the finances or the ability to do that, and also maybe more chronic diseases, so you're kind of focusing on that and trying to manage those, whereas I have a lot of people coming in who are very healthy and they just want to mind their health.
Yeah,
And I love that. Hopefully that will, that eventually translates into being that less people have diseases, and so the people who do need the healthcare, there's a space for them there, and you're kind of opening up the system by identifying things early on.
absolutely. Yeah. I mean it's difficult for sure, but I think in the long run the preventative approach is it's so empowering, because
Yeah.
like um I've worked with a good few people who have been, let's say, on um statins for their blood pressure for years and years, or you know, doctors have prescribed some people antidepressants,
Mhm.
but they didn't suffer with depression. They actually had issues that they were struggling with during perimenopause,
Yeah.
or, a lot of people prescribe different things and it wasn't really helping them in the long run. And then as soon as they started to just focus on things like improving their sleep and managing their stress and eating better and, that kind of stuff, regulating their blood sugar levels, a lot of people as they get fitter and stronger, then not everyone can come off something for their blood pressure, but a lot of people can, or so it's definitely more empowering when you have that preventative approach, and you know
Yeah.
that's
Yeah.
pretty positive.
I do think as well with medications, this medication isn't the final answer for me. That's another thing. Like I love preventive health, but also, medication only works in line with something else. So it needs to be in line with, lifestyle changes. It's a bit like when you get a muscle injury, you can take painkillers and anti-inflammatories, but actually at the end of the day, it's physiotherapy and the exercise that are going to make things better. And you can't just take an anti-inflammatory and just hope things will improve. You've got to do
Yeah,
the work with that. And I think it's the same with all aspects of your health, your cholesterol, your blood pressure. You know, unfortunately it's very, everyone looks for the quick fix, but actually
Mm.
at the end of the day, okay, you can start a medication, but actually you need to make the lifestyle changes along with that.
Yeah, I wish there was like a magic pill that you could take and it just like gives you
Yeah.
everything in one. Maybe there will be something like that in 100 years, but for the moment
Yeah.
it's not there,
No,
unfortunately.
definitely not at the moment. Exactly. Yeah. And I know myself, like I've had a few things, like not nothing major along the way, but like injuries and a few bits and pieces. And I've always gone to the doctor and been thinking, they're going to tell me they're going to fix it right now. They're going to flick it switch and
Mhm.
it's gonna be better. And then it's not been the case, So I think
Yeah.
we all hope for that. But yeah, it's certainly there's definitely no easy solution. I think
Yeah.
definitely like the work you put in definitely pays off. It's not all about the medication.
And it's really interesting that you said that, because maybe someone who isn't a doctor would think like, oh, every GP, every doctor, they have everything sorted. They know exactly what they need to do, and they can just figure it out themselves. And I think people probably have a misconception as well about, like maybe people like me who are like health coaches or personal trainers that like, oh yeah, they don't struggle with motivation at all. They're in the gym 24/7. And it's like it's not the case.
Yeah.
I struggle with
No.
motivation a lot of the time. I'm human,
Yeah.
same as anyone else, and you're human, the same as anyone else, So, I
Yeah.
think that's a good reminder for a lot of people that,
Yeah.
then if you
No,
are
it's really
knowledgeable.
No, it's really tricky. I mean, for yourself, as your own health, but like I have a little 4-year-old, and I remember she was really sick when she was about like almost 2 years old, and she had like bad breathing because she had croup, and it was kind of like wasn't too bad, but it wasn't, it wasn't quite right. And it was about 2 in the morning. I woke up and I had her sitting on the couch. And I was kind of looking at her, being like, "Oh, will I go into A&E? Will I not go into A&E?" So then I rang my dad, who's a doctor, and he was like, "Sure, I'll come over." So she was sitting on the couch. You can kind of picture this. She was sitting on the couch kind of okay. Like her breathing was very noisy. That was the big thing. But then we were standing in front of her with our hands on our hips, looking at her, being like, "What do we do?" I'd say she was looking at us like, what are they doing? What are they thinking? Sort of thing, because we just looked so perplexed. And then my dad was like, "Do you know what?" He was like, "Just bring her in." He was like, "Do you know what? The safest thing to do is just bring her in, and then we don't have to worry about this and not think about it." And I actually went in and got her sorted out and got her treated, and it was the best thing. But you're almost like more inclined to like not to go into hospital when you're a doctor, I think, because you sort of think you're almost over calling it. So it's
Mhm.
really tricky. So I think, health is just so tricky. And so when patients come into me and say, "This might be a stupid question, this might be too simple, this might be silly," I'm like, absolutely not. Come in, ask that question. I've probably wondered myself that before about myself. So come in and ask that question. And if it's a quick consultation, I sometimes don't charge people, or else I'll be like, "Do you know what? Your bloods are due. Let's check your blood pressure while you're here. Is your smear up to date? Have you checked your breast recently?" And you can always, look for something that's really important from a preventive point of view.
Mhm.
Just have that opportunity. I think that's a big thing for me, is like taking the opportunity to actually do something while a person is there.
Yeah, no, that's amazing. And is your daughter doing better now? She's fully recovered?
She's good. Yeah, no, this was like she's 4.5 now, so this was good a few years ago.
Oh,
And
okay.
touch wood, she actually never seems to get sick, so I'm very lucky.
Nice. Good stuff. Glad to hear it. Yeah, and I suppose it'd be good to chat about what you said about, stupid questions, because I think that's really common. A lot of people just kind of second guess themselves like, oh, I shouldn't say that, or I shouldn't ask this. But like you said, it is so important because it can really open up a whole maybe bunch of other things that maybe someone wouldn't have thought of. And like you said, there's so many different tests that you could potentially do, like the smear tests, or like you said, the breast cancer screening or blood pressure. Like the amount of people that I've worked with who I've asked them, do you know what your resting heart rate is, or do you know what your blood pressure is? And they don't know. And it's such a
Yeah,
basic thing, but if you even know that, then that'll give you a good idea. Because if your resting heart rate is above 70, then you're a little bit more in the risky zone. And obviously if your blood pressure is, it's ideally it should be like obviously 115 over 75 or 180 over, or not 180,
yeah,
120 over 80. But if
yeah.
someone came into you and their blood pressure was like, let's say 160 over 100, that'd probably be worrying, right?
Yeah, and you pick up loads of that. You'd be surprised how many high blood pressures you do pick up, especially once people go into their 40s, 50s, 60s, you're picking up loads of high blood pressure. So, and like, blood pressure you can actually do in a pharmacy. You don't have to come to a doctor. You don't have to have a home monitor. You can just go down to the pharmacy and get your blood pressure. And I'm pretty sure it tells you your heart rate as well. But it's easy to do. And I suppose it also brings you back to that whole misconception thing. I think it's kind of hard. What I hear from a lot of people is they've gone to talk to their GP about especially hormonal health
Yeah.
and menopause, and then they've been told it's not perimenopause because your blood tests show normal hormones, or you're the wrong age. And I think it's actually that misconception from the medical side as opposed to the misconception from the patient side. Um, because, it's in perimenopause, we don't do hormonal levels unless, thyroid hormone we sometimes check to make sure it's not a thyroid problem mimicking perimenopause. But we really don't do hormonal levels in perimenopause because they're fluctuating so much. Um, so, because I had a lady in last week and she was saying, oh, I was with another GP and they checked my bloods and they said I'm not in perimenopause because my hormones don't show that. And I was like, forget about the hormones. This is all about your symptoms. And so, it can be really difficult then if you've gone to somebody and they've said to you, no, that's not it. Like you're not the age for that. It's not that. And feel a little bit dismissed. And that's not to diss my colleagues, but I have heard that from lots of women in the menopause clinic. Um, and to go back to that person then and say, well, actually, I don't agree with you, or then to bring up another topic because you think you're going to get dismissed again. So that's why I'm always like, talk to me about anything at all. And I really like to know if people have Googled or used ChatGPT. Like a lot of people, they'll be like, oh, my consultant said, don't ever Google things, don't ChatGPT them. And that's fine. But like, it's better to know the person has Googled and has ChatGPT'd and what they've been told. Because that's going to preform a lot of their thinking and sort of kind of influence their expectation as well. So if you know what that is, it's really helpful from your point of view. And it could be right, actually. So, it's really helpful to know, has someone Googled something? Has someone put something into ChatGPT? And
Mm,
actually, what was the answer? Now, what's that person thinking?
for sure. Yeah, there's so many things I want to go through there. So I think we'll go through them one at a time. And they're all important, but I think I'll start with the one that's most important around a lot of women feeling gaslit essentially by their doctors who say, like you said, you're the wrong age, you couldn't be in menopause, things
Mhm.
like that, because I've worked with at least two or three people over the last few years who entered menopause in their mid 30s.
Yeah.
And if if some doctors haven't been trained up fully on menopause, they might say that like, oh, you can't be because you're too young, but that would
Mhm.
be incorrect, right? So it'd be good to, I suppose, chat a bit about that. Like, what have you seen in practice of like age range of people that have entered menopause, and what are maybe some of the things that contribute to someone going into like early menopause?
So average age of menopause in Ireland is 50, 51. And menopause is just when your period stops. So that's really confusing, I think, for people because when we refer to menopause in language talking like this, a lot of the time what we mean is perimenopause and menopause and the early postmenopause period because we're talking about menopausal symptoms. But really, menopause is just when your period stops. And if you go through menopause over the age of 45 up to 50, which we're saying is the average age, or up to some women go through menopause at the age of 58, so their period stopped that late. That's completely normal. We count that as being like a normal age for menopause. If you go through menopause less than 45 but over 40, that would be early menopause. And again, that's not really a huge problem. It's just you've gone through early menopause, but it's useful to know. And then, but especially, I suppose, especially if you have fertility goals under the age of 40, if someone goes into menopause, that is premature menopause or premature ovarian insufficiency. So the ovaries are beginning to become insufficient or they're not working properly. And for some of those women, actually, they might still have some periods or the odd period, but they just their hormonal levels are showing that they've gone through menopause. So that can be confusing. I can see why that can be confusing for people. But if you lost your period in your 20s and 30s, um, and we do at that stage we do hormonal levels because we want to know if you've gone through menopause at that stage, and it shows that you've gone through menopause. Then yes, you've gone through menopause at that stage, and it's really important to identify that because those women they've lost those lovely hormones that are protecting their heart and their bones, so they really need like TLC. They need hormonal TLC up to the age of 50 when we are assuming natural menopause would occur, and the reason for that is because protecting their heart, protecting their bones, but also because they may have menopausal symptoms. So we want them to be as comfortable as possible. Things that can influence that is family history. If you've gone through, say, surgery or certain medications like chemotherapy or cancer treatments, that can affect you going through either premature menopause or premature ovarian insufficiency, so under the age of 40, or maybe early menopause, so over the age of 40, but under the age of 45. Um, but that's why age is but a number when it comes to menopause, because you can go through it at any point. And the really important thing is, not so much, from our end figuring out well, have you gone through premature menopause? Has it been early menopause? Are we talking just normal menopause? And the really important thing for you as a patient is what are your symptoms and how can we help you and what are your goals with your symptoms? Is it to protect your heart, protect your bones? Are you someone who's athletic who's finding they're now struggling with their performance because of hormonal changes? Do they have fertility goals that they want to assess? Because women really do get pregnant right up to the age of 50 now. I've had several 50-year-olds get pregnant. Um, like intentionally they want to get pregnant. So, there's lots of like discussions around hormones. And even if you go through menopause in your 20s and 30s, in theory, then your ovaries have stopped working, and so your fertility is gone. Even those women, about 5% per year, will spontaneously ovulate and could get pregnant if they had sex around that time. So for some women, they don't want to be pregnant. So then you're having to talk about contraceptive in case that happens. So it's really important that no one's dismissed, and we look at it in all seriousness, not on the basis of age, on the basis of symptoms and periods.
Yeah, that's amazing. I think a lot of people are going to find that helpful for sure. And one of the books I read about 5 years ago is called The Period Repair Manual by
Okay. Oh, I don't know that one.
Dr. Laura Briden. It's really good. It's a long one. I can't remember. It's like 300 or 400 pages, but I read
Okay.
that over a few times. And there's a few other authors like Dr. Geraldine Pryor. She's an endocrinologist in Canada, and Jolene Brighton, and a few other people that I read. And the main thing that I've seen across the board, and correct me if I'm wrong, um, that most doctors would consider somebody is in menopause once they've gone a full year without any period or spotting or anything like that,
Exactly.
obviously.
Exactly. So if you were in your 20s and 30s and your period was gone for a year, especially a year, like 6 months, you probably still would start investigating because you'd be a little bit worried about someone losing their period for 6 months without being on hormonal treatment and obviously not being pregnant. But you would be concerned, but definitely a year is usually what we say.
Hmm.
Um, there is this slight, that sometimes people would get irregular periods and could have gone through um early or premature menopause and they're just getting some periods, but their hormonal levels will be very high. But that's more unusual. It's more common just that the periods are gone. And then
Hmm.
for that, you do hormonal levels because the periods have gone, your hormones have gone to very low levels as well. So you can do hormonal testing because nothing is fluctuating. It's all just statically low, unfortunately.
Yeah.
So then that's why you can do testing for that. But in perimenopause, things are fluctuating. So you're not testing hormone levels. But yes, we say a year without your periods, you really do start thinking about it.
Hmm. Sounds good. And we'll definitely go into more about menopause, but just while we're on the topic about knowing which kind of point you're at, because obviously, like you said, there's when you have a regular cycle, perimenopause, menopause, and then postmenopause. So there's kind of like four, let's say, sections or areas that you go through in your
Yeah,
adult
exactly. And
life.
that's exactly. There is a graph and it's got like, I think it's like 9 sections or 12 sections on it that they use but for the sake of like, and then it's your hormonal transitions. But from looking from the point of view of like simplifying it, it's yeah, your reproductive phase where you're getting regular cycles. If you are somebody who gets regular cycles, then you've got your perimenopause where things are roller coastering around. So you're getting either normal hormonal levels or very low hormonal levels, or actually some people will get really high hormonal levels. And that doesn't feel nice either because you get breast tenderness and bloating and nausea and things like that. And then you go through menopause, which is the final period. And that's, as you said, we only know that's been a final period looking back. So, if you didn't have a period last month, we don't know that you're not going to have another 11 months of no period. So we can't say, well, that was your last period. So we go, when you've had 12 months of no periods, and we kind of say, well, look, there's not going to be another period coming. Because some women, just before, their menopause, they might have a period and then nothing for 3 months. And then bang, there's another period comes along. And then it could be 2 months and they get another one. And then 5 months and suddenly there's another one. So that's why you really need the 12 months to say, okay, 12 months has gone by. It's really unlikely you're going to have another period. So that 12 months go as your last period.
Hmm.
And then you go into the postmenopausal phase. And like early in the postmenopausal phase, your hormones are dropping down to a very low level. And that's really uncomfortable for some women because they've been used to having decent hormone levels. For some women, like we say, 25% of women don't get any menopausal symptoms, and then 75% get symptoms. And of those 25, 25% are severe. So, there are some people who will get through perimenopause actually okay, and some women come into me and they're like, I'm missing the whole point here. Like I'm not feeling anything. And I'm like,
Yeah.
that's okay, just not feeling anything. That's okay. And then the periods stop and actually the hormone levels go down to really low levels. And that's when they start noticing symptoms, especially vaginal dryness. Your vagina does not like not having estrogen. So your vaginal dryness can start at that stage. And that's a real symptom that will continue in your postmenopausal period into your 70s and 80s and 90s even. So some women, it's that early postmenopausal phase, they'll start noticing symptoms. So I have this little graph that I kind of show everyone in the clinic just to see where they're at on it. And I base that entirely on what they're telling me of their symptoms. Sometimes blood testing if I think it's needed, but really it's just based on what they're telling me in terms of periods and then the symptoms they're having.
Yeah, I think it's really good to simplify things as well because I've just noticed even like when I was in college or if I'm like reading something about like exercise science or whatever, it's like if it's put in layman's terms, it's just so much easier to conceptually understand something than when, because a lot of people like to use really big words that make
Exactly.
them
Yeah.
sound smart. And it's like,
Yeah.
okay, that's cool, but I
Yeah.
have no idea what you mean, you know?
Yeah.
So,
And I love this graph. This graph is I show it to everybody. I have this little slideshow I show people when they come into me, and it's the same graph. And like if you can kind of picture that, like you can picture especially the roller coaster hormones of perimenopause. Like once you see that, you're like, okay, I understand now why I'm in this roller coaster. Because you could be having a good day, a good week, a good month, and then the following month could be, or following day, or following week could be bad, and that's because your hormones are switching around so much.
yeah.
And like some women who come into me, they're like, I'm just here for information. I don't need HRT. I just want to know, be informed, talk to you about things. And then a month later, they come back and they're like, oh my God, I was kidding myself. I need the hormones. Give me the hormones. And I'm like, no, you weren't kidding yourself. You were just getting in a good hormonal spot last month. And now you've, dipped down into the dip of the roller coaster. And now you're, not feeling great. And the idea with HRT then is just to balance that out and get you through those symptoms. And it doesn't, we're not trying to put off menopause. We're not trying to push it out. We're not trying to, take the hormones away in the future and you go plunging into menopause. We're just trying to bridge that gap. And then your body will get used to the new level of hormones in the postmenopause period. But until your body gets used to that, it's you're feeling all the symptoms of not having those hormones in the same way.
Yeah, no, I think it's so important to understand all this, because it's pretty like funny the reactions that I get because obviously being a man, a lot of women are like, "Why are you mentioning?
Yeah.
Why are you talking about menopause or perimenopause or periods or cycles? Like you shouldn't be talking about that kind of stuff."
Yeah.
So I understand, obviously, but it's
Yeah.
not a very common thing. But
Yeah.
the thing that I re realized, like about 6 years ago, when I started to kind of specialize working with more women, is that there's just not like good information out there, like
Yeah.
generally. And then there's also a lot of people who just don't really have a basic understanding of why it's important to know, you know, the different things that happen within a regular, cycle and, different things that come up in perimenopause and menopause and how, like you said, low estrogen or, different things with progesterone or testosterone can affect how someone feels. And it's just like, not that widely talked about. Yeah, for anyone who's a personal trainer or health coach or anything, and you work with women, you have to have a basic understanding of stuff like this to be able to empower someone that you work with. So that's why I like to bring up stuff like this and talk about it because it's so important. And there's like, do you think there's still a bit of a taboo around even talking about stuff like this?
Yeah, I think so. I mean, when I first spoke to you, I was just thought it was brilliant. I thought it was so great that you're so interested in it. Because well, there's not, I think there are still a lot of men who don't know about hormones and maybe
Yeah.
don't want to know. But every man has a mother, a sister, or wife, or someone, a female in their life anyway, girlfriend, partner, whatever. But but as you said, it affects everything. I think if you're working with women at all, it's your hormones affect you from really, preteen or to teen to all the way up. So if you're working with women and we're lined with estrogen receptors from the top of our head all the way down to our toes, so it affects everything. Like you see more frozen shoulder in menopause and you see people's muscle mass changing and muscles changing, and there's so much talk about weight gain in menopause, and that's due to all the changes that happen as well. So it's so important. I think if you're going to work with women and understand women physically and mentally, that it's really important. And so I was totally inspired when I spoke to you that you were so interested in it, and as a result, I've referred lots of women your way. But
Appreciate
I
it.
think they still like, yeah, I did a launch event for this menopause project I was doing 2 years ago, and there were two men in the room. I think it's getting a little bit better. I did a few talks last year for a few companies, and it was like one of the talks, it was like 50-50 men and women in the room. And actually, at the end, I had a queue of men coming up to ask me questions. So I thought that was brilliant. It was really good to see that. I think we assume because there is so much in social media and the media about menopause that there's probably less stigma around it now. But I do a lot of public speaking in different areas on menopause. Not the court. That was more probably a bit more corporate talking, but in communities, and I often pick like low socioeconomic communities because I find that's areas where people don't have information on menopause a lot of time. And some of the stories you hear there of what like husbands are saying to wives about menopause is just absolutely shocking.
Really?
Um, yeah, and like some of the language used, and and there is definitely a knowledge deficit in in some places that I've been to. So there's definitely still like I think in a sort of broadcast way the stigma is being lifted. But I think, behind closed doors and, between individuals, there can still be quite a bit of stigma there.
Yeah, for sure. And obviously you don't have to if you don't want to, but would you be open to sharing some of the things that you've heard or not?
Yeah. Yeah. I mean, things like, oh, it's that time of the month again. I mean, it doesn't sound like the worst thing, but for me, that's like, you shouldn't say that to somebody, that's like a really hurtful thing to say to somebody, or, it's your hormones, or, people saying you've got to go to the doctor and get sorted out, otherwise I'm going to divorce you, or, they just, really, really unsupportive comments, and like,
Yeah.
if you're from different backgrounds, you might see that differently. But for me, that's like not acceptable way to talk to a woman.
No,
It's no one should be just put in a box and told, what that person thinks is wrong with them. It's
absolutely.
shocking.
Yeah. No,
So
I completely agree. Like, because men, imagine if we roll reverse, right?
yeah.
And you said all of that to men, how would they react?
That's it. That's it. Exactly. Exactly. Absolutely. And like, coming from like really like some difficult relationships as well, because I do get people talking to me afterwards about their relationships, and, um, you know, being unsupportive in general, and then, using this as a blaming tool as well, that it's like, you're not doing what you should be because of your hormones as well. Um, which
Yeah.
is just so wrong,
Yeah, it
uh,
really just stems from just ignorance and not understanding and
yeah,
everything related to that, because if you even had a basic understanding of things, then you'd be able to have some type of empathy,
yeah,
and just understand, how things work, and then not have to. A lot of people who say stuff like that, they're just using it as an excuse anyway for
yeah,
something else. They just wanted to complain about something and they're using that as
that's
a
it.
way to complain, so it's really poor form.
And as you said, a lack of knowledge and lack of understanding as well,
Yeah.
and not really wanting to understand the individual. That's the other thing, just kind of trying to blame it on something else other than what they can do for that person.
Yeah, definitely. And I think it's something that I focus on with a lot of people. Anyone that does have a regular cycle, it's so important that you have your food and sleep and training and maybe even work if that's possible for you in
Yeah,
sync with your cycle. Because it's normal that your energy levels might fluctuate a bit, depending if you're at the
absolutely.
start or the end of your cycle. So many different things can fluctuate. Some people don't obviously even feel any difference. I've worked with some women who are like, I am literally all good. Doesn't
Yeah,
matter what time of the month it is, or where I am in my cycle. And then
yeah,
other people are much more affected.
yeah.
But
I think it's well expected by that stage in your life, as well, because obviously teenage years, you're new to your periods. PMS, PMT can be worse. Periods can be heavier, lighter, more painful. Always really important not to ignore that really painful, heavy period that could be endometriosis. But then I find people in their 20s and 30s, sometimes that PMS and PMT and those, energy levels around the cycle actually settles down a bit. And then perimenopause, unfortunately, you get this resurgence, and I'm sure you see it in PMS and PMT as well. So, you can actually go through phases where, your hormones are okay, and you're not actually finding the cycles are so impactful. But then unfortunately that doesn't always stay that way, and it can change. I think that's a big thing is being really mindful, because I think sometimes you can kind of miss it. You can kind of not see it happening. So I think these apps where you can track your cycles are actually really, really good. People sort of say to me, like, do you think that's a good thing? And I'm like, well, yeah, even if you're not doing it the entire time. Sorry, there's a car across the street, I think.
Oh, good.
Even if you're not tracking your cycles all the time, but if there's an episode in your life where you feel actually my hormones are affecting me a bit more around my cycles, then picking that as a time to look at the cycles and track what you're doing in terms of sleep, caffeine, alcohol, diet, exercise, and how your feelings are around that are really important.
Yeah, for sure. An easy one that I use is just a score out of 10. How are you feeling
Yeah,
today? Energy wise
yeah,
out of 10.
yeah,
How are you, like out of 10 stress wise, mental health, mood, so many
yeah,
different things you can do. Um, but yeah, I think it's obviously like you said, you don't have to track things perfectly all the time.
yeah,
But if you did track fairly consistently, then over maybe a 3 or 6 month time frame, you'd be able to see what are
yeah,
fluctuations, is there a bit of a pattern there or,
yeah.
and
Yeah, I
then
just mean, you don't need to track for years on end, but I think if you find, because I know even with me, I'm like, what's 40 in February, and I'm definitely like PMS, PMT is resurging. And definitely have these parts of my cycle where I'm like more irritable and, and more fuse. And I was kind of like, it's definitely not related to my cycle. I was completely ignoring it. And then I actually did track it for a bit. And I was like, oh, actually, do you know what? Over a 3 month period, it's pretty consistent. So I think it can be really useful, and trying to think about it. I think trying to think about it is really hard, because it's like, we've so much to track and we've so much to think about, and trying to use like, oh, like I did that day, and that was whatever day of my cycle, I went on holidays, it's too bitty, whereas actually if you do a really good tracking, that can make a big difference.
definitely, yeah. What are some of the things that you found helpful for PMS and PMT? Was there something like specific, like supplement wise, or what did you find?
But I mean, vitamin D. Everyone's supposed to be taking vitamin D in Ireland from October to Halloween, or sorry, Halloween to Paddy's Day,
Mm.
and I'm pretty bad at like remembering to take it. So what I do is I do a monthly vitamin D tablet, so I find that quite helpful, because then I don't really have to remember it every day, and I do actually tend to remember the monthly. So I definitely take that, and I find that really helps. Like if winters where I haven't taken it, I've found by the end of the winter my energy levels have been really bad. But I think from the point of view of PMS, PMT, it's been like healthy eating, definitely avoiding alcohol. That really makes it worse. Exercising. I'm in a terrible not exercising buzz at the moment, because I've been just working too much. But that's no excuse. But like those things make a big difference. And then I actually love meditation. Again, it's kind of dropped off at the moment. But one of the
Mm.
practices I used to work in as a student, training to be a GP, we used to do like a 5 minute meditation in the morning time as a whole, as a practice. So anyone who wanted to do could join it, and we just did a headspace meditation for between 3 and 5 minutes, and I found it such a good start to the day. And I was actually really, really heavily pregnant when I joined the practice. So I was like, I think I was like 34 weeks pregnant, maybe 30 weeks pregnant. And so I had this like massive bump, felt very heavy. It was actually kind of in the midst of COVID, but we managed to have a big room where we all spread out and wore masks and did it. But I just found it was so good. And it just, like, you're sitting in the chair, you close your eyes, and the start of it is you focus on this kind of body mapping, and you kind of focus on your feet on the floor and your legs in the chair. And I loved it. It was just such a good connection with my bump, and where I was in the pregnancy and everything. And obviously, like, I've pregnancy is amazing, and I love being pregnant, but I found physically being so heavy and what felt really big to me really challenging.
Mm.
Um, because I've always been kind of quite slim, and I just found that was really challenging. But I found this was like, I kind of just felt lighter in that moment. And I do a lot of swimming, so it almost brought me back to that swimming feeling. So I found that really good in terms of just, and that was, a lot of that was hormonally driven as well, the symptoms of being pregnant, obviously.
Yeah.
But I think meditation is a brilliant thing.
Amazing. Yeah. Thank you so much for sharing that. Really good. So the list is basically vitamin D. And so just to clarify, is it vitamin D3 that you recommend or?
Yeah, yeah.
Okay, cool. And so the vitamin D3 monthly tablet, is that just one that you take per month
It's
or how does it
one.
work?
Yeah, one per month. I usually take 25, is it 25,000? Yeah, 25,000 units. Um, I practically have to look it up every time I prescribe it, but I think it's 25,000 units. You can go up to 50,000 units, I think, as well. I don't give it to people, not many people sort of want it. I do mention it to people, but sometimes people sort of
Yeah.
say they'll forget to do it. But it's basically 25,000 units or 50,000 units, and you
Yeah.
take it once a month. And it means you just don't have to worry about the daily tablet.
Makes
Yeah.
sense. Yeah. The supplement that I use for my immune system, pretty sure it's 5,000 IU vitamin D3 and it's supposed to be like once a day. Um,
Okay. Oh,
so,
wow. Yeah.
so the one that you recommend, it's around 25 to 50,000 IUs
Per
once per month, and
month.
that gives you enough to
Yeah.
last through that time frame.
Assuming you're not deficient or insufficient in it.
Yeah, amazing.
Yeah.
Yeah, that's really good to know. I didn't know that you could just do one large
Yeah.
dosage like that.
One
So
large is, yeah.
that'll be
And
helpful.
if you're deficient in it, you can take like 25, I can never remember dosing, but it's 25 to 50,000 units per week for 6 to 8 weeks. And then you go back down to your normal dosing after that. But
Hmm.
it means you're not having to take like a daily, you can take it in a weekly dose and just bump yourself up weekly,
Yeah,
which is really,
amazing. Yeah, because as far as I'm aware from what I can remember from studying biochemistry, vitamin D is actually a steroid hormone and is extremely potent, hence why we need it. And in Ireland, obviously, we're deficient, right?
yeah. So basically in our end, our sun doesn't get high enough. So it's not that, everyone always says, oh, well, the weather's so bad. And yes, the weather isn't great, but it's also our sun doesn't get high enough in the winter months. So I was talking to Connor Curley recently, who's Dr. Connor Curley, who's a dietitian, and he does a lot of women's health and endometriosis and sort of supplements for fertility as well. But he was explaining to me, which I thought I loved, if your shadow is longer than your body, so if you're like looking in the ground and if you're on, when you're walking along the beach and you see your shadow stretched out for miles in front of you, in that sunlight where your shadow is longer than your body, you are not making any vitamin D. Whereas
Oh,
if the sun is then higher and your shadow is shorter than your body, in that sunlight, you're making vitamin D.
nice. Yeah, that's a neat
Um,
way to remember it.
it's easier to remember, isn't it? Yeah. So if you think about the winter months when you're doing like your frosty beach walks and your shadow is really long, that's when you're not making vitamin D. So you need to take your vitamin D.
Yeah, no, it makes sense. Yeah, and when you mentioned the weather there, I think it's just like national pastime in Ireland of like, oh, it's we just love to complain about the weather,
Yeah,
right?
exactly, exactly. Yeah, that's it. And I'm like eternally optimistic. So I'm like, no, no, it's not the weather. Like the weather's bad too, but like really it's the sun isn't just high enough.
Exactly.
Um, we get good weather too.
And so the other things that you mentioned, and I think for some people, they probably don't realize because obviously alcohol is just so socially accepted in Ireland. It's like
Yeah,
a lot of people don't realize just how harmful it is. And having, or like you said, if you can quit or reduce alcohol,
yeah.
especially in the second half of your cycle, then you're a lot less likely to, or well, you're going to be more likely to reduce issues or symptoms you have of PMS or PMT, right? Just because of how much it impacts you.
Yeah, and then things like as well, as your estrogen levels drop in the second half of your cycle, you tend to get more bladder problems, so bladder leaking and things like that. And that's even, if you look at younger women like in their 20s and 30s, actually a lot of women will leak in that age. It may not be talked about, and that's a big stigma in terms of talking about stigmas. But actually, I think they say 1 in 3 women will leak in their 20s and 30s, and then it goes up to 1 in 2 when you're around perimenopause, menopause. But a lot of women will find they leak around the end of their cycle just before the period comes as their estrogen levels drop down. And if you add alcohol into that mix, it really irritates the bladder. So that's going to make that worse as well. So
Mhm.
I often say that to women and they find that really helpful because, they're finding they're leaking. But actually, if you take the alcohol out of it, it's irritating on the bladder. It's not just that it's filling up, it's also diuretic. So it's kind of,
Yeah.
making you pee, but it's like kind of irritative on the bladder as well.
Mhm.
Um, And then also the scary thing is alcohol is associated with a lot of cancers. So we know, and the statistic I know most well is because of menopause, but if you look at women in the 50 to 59-year-old age group, the background risk of breast cancer, if you follow 1,000 women over 5 years, 23 women in that age bracket will develop breast cancer. But if you add an alcohol to that, you get an extra 5 cases. So if you drink, now this is daily alcohol. So if you drink one glass of wine at home, which is generally 2 units of alcohol, because we tend to measure a bigger glass of wine at home, you get an extra 5 cases of breast cancer in that age group. So it's really important to have alcohol-free days. So days where you're not drinking alcohol, otherwise you're sort of accumulating that risk in terms of breast cancer risk.
Hmm.
Um, so it's really important, from so many different points of view in terms of health. And I suppose there's so many calories in alcohol as well. So if you're trying to lose weight, it's really is. And like, I love my wine and my cocktails and everything, but it's trying to be, I think, conscious about it, because I know during COVID, I think a lot of people kind of slumped into this kind of glasses of wine a night, and those meal prep boxes, and having making your home margaritas around your Mexican or whatever it might be. I think a lot of people have said this to me, that find it hard to get back out of that again, that they're used to drinking wine in the evening time, and trying to come back, change that is quite difficult.
Yeah, and it's normal as well. I mean, like, especially with the pandemic is so stressful and isolating for a lot of people. And
Yeah,
when, it's normal if someone feels stressed or lonely, there's only so many coping mechanisms we can use to deal with that
yeah,
stress, and alcohol is an
yeah,
easy, cure for that isolation or that stress in the short term, but obviously in the long term, it ends up not being helpful. Of course, everyone, well, not everyone, but most people know what it's like to wake up with a hangover and regret every decision you made the night before, right? So,
absolutely. And, like, hangovers are definitely worse around PMS, PMT, and perimenopause. Like, a lot of women will stop drinking around perimenopause and menopause because they just feel worse. Now,
yeah,
some people will turn to alcohol because they can't sleep, so they find the alcohol does help with initially going to sleep. It does kind of shorten your sleep, so you wake up a little bit earlier. But they find that it helps them get to sleep. So you'll see changes in alcohol pattern around perimenopause and menopause. But in the long run, I think it's not gonna help with things.
yeah, definitely. And such a scary stat as well. So you said it was 23 out of 1,000 that between the ages of 50 to 59 um, will get
Over.
cancer. So 23 out of 1,000, that's like 2.3%, I think.
Yeah.
And then it goes up if you have, is it one glass of alcohol per week, or what was the,
Sorry, every night, one glass of alcohol every night.
and then it
Uh,
goes up to 2.8%.
yes, yeah, an extra 5 cases, exactly. Yeah, yeah.
Wow. Yeah.
So,
It's scary because it's something like that. When I think about alcohol, and if I'm, talking to someone about it, we're talking about it in the context of, like, ideally we want to cut out alcohol because, you want to increase your energy, you want your mental health to be better, you want to be in a better mood.
yeah,
Obviously, like you said, around the end of your cycle, ideally you want to have no alcohol at the end of your cycle just so you don't exacerbate any PMS issues or anything like that.
yeah,
But the cancer side of things is not something that many people, even me, really think about. So I think that's a really good one to just have the awareness of, like, it is putting you at a higher risk.
yeah,
So it's like I love daiquiris and martinis and stuff as well, but
yeah,
even now I'm like I'll maybe have like one a week,
yeah,
one every few weeks. Yeah.
yeah. Yeah,
Um,
and I mean, it's really. I know during COVID, I wasn't working. I was on maternity leave for like the kind of the second year of COVID, and I kind of stopped breastfeeding. I wasn't back to work, and I was like, still, I was having a glass of wine every night, I think, practically. And it's so easy to slip into it. I was like, well, I'm not going out, so, like, I can have a glass of wine and it's not going to affect me. But it's especially the long term exposure, like the longer you're exposed to something, the duration of exposure is just so important. Um,
mhm.
so luckily I went back to work and I had to be like able to concentrate. So that stopped. But like it is easy to, to sort of slip into a pattern with things.
Definitely. Yeah, it's kind of scary as well. Like I've seen it with a few people who have been honest with me, and they're like, for the last while, I've been having a bottle a night.
Yeah. Yeah, exactly. Yeah.
It's just like you said, it's so easy to like slip into that, especially if you're, really busy at work or you've got a lot going on and managing stress. So, um, yeah, I think like anything, you don't have to be perfect with it. And my approach is always like something sustainable is like I'll if I want to have a drink, that's fine. I can do that every few weeks, but I'm obviously not going to be drinking every night. So it's just like where is that
Yeah.
sweet spot? And then that's kind
Yeah,
of
I think
sustainable.
the balance. Like, I think a lot of people come to me and like no one leaves my room without a conversation about fiber, which,
Okay.
is not exactly a very sexy topic, but so important. Like, women need 30, 32 grams, men up on 36, 38 grams of fiber a day in their diet. And it can make such a big difference. And I think people come into to you as a doctor and I think you're going to say no chocolate, no sweets, no desserts, no dairy, no meat, cut everything out because of your cholesterol, because of your weight, everything. And I'm like, it's about a balance. It's about having those little things, but in moderate amounts or moderate in moderation. Um, but also like fiber is a big one. I'm always like just add it in and then you can cheat and have whatever it is you want. But like as long as you're getting a good amount of fiber in your diet in a day, it's actually going to sort of almost cancel out some of those bad habits.
Mhm.
And you can see big differences in people in terms of weight loss. They're not as hungry as they usually are, and then actually they don't really need that extra treat. You'd see blood pressure coming down, cholesterol coming down. It can make such a big difference. So for me, I'm always about like adding in as opposed to taking away. So adding in as much fiber as possible. And like if you don't like those high fiber foods, I have this little chopper from Argus when Argus was here, and it just chops everything down really fine. So like I love all fruits and vegetables, but my daughter's going through her, I want everything that's white phase. So I just
Yeah.
hide everything in things and she just doesn't know it's there. So if you need to hide it on yourself, that's okay too. So just like chop it up really fine and hide it in your spaghetti bolognese or whatever your soup or whatever it might be. But
Yeah,
it's
hopefully your daughter doesn't listen to the podcast because then she'll know you've been hiding stuff
exactly. She'll know
for
what's happening.
years.
Exactly. I know, in fact, she was like, I said I was doing a podcast this evening, and she pretends to be doing a podcast now because I do my own podcast, and so she pretends to be doing a podcast on. She'll be sitting there and she'll be like, okay, oh yeah.
Oh, that's adorable.
So she'll definitely want to listen to this one.
Oh, nice.
But yeah, I think it's about moderation. I don't think it's about, it doesn't taking things away from yourself altogether just doesn't work. It's not a sustained effect. And with your health, it's about sustained effects and the impact of sustained effects. So for me, that's really important.
Yeah, no, definitely. And it makes sense with fiber as well, because you think about the foods that you get fiber from, like the first one that came to mind in terms of fruits, like strawberries or blueberries or
Yeah,
things like that. They're extremely low in calories, but high volume.
yeah.
Um, like from memory, a full punnet of strawberries, I think it weighs around 500 grams or something like that, but there's only around 150 calories roughly
Okay, yeah, yeah,
all of those strawberries. So there's a high volume
yeah,
and a lot of eating in it and a lot of
yeah,
fiber, but not a lot of calories. So that automatically
exactly.
helps with weight loss or, anything when it comes to energy improvements and stuff like that.
Yeah,
So,
my thing I quote is an apple is 4 grams of fiber. And I know when I was in college and I wanted to like drop a dress size to go to some sort of event, I used to go on these like crazy apple diets.
oh no.
So not that I would advise that, but it just shows you like, that apples are probably pretty low in calories. But really like with 4 grams of fiber in an apple, that's a really good amount, or a pear is like 5.5 grams.
Yeah,
Um
exactly. Yeah. I think an apple is roughly around 40 to 50 calories. So it'd be mostly, let me see, it'd be about probably like 8 to 10 grams of carbs. And then the rest of the calories would be probably the 4 grams of fiber. So that'd be around 50 calories.
oh yeah, okay, so it's low,
Um,
yeah, yeah.
so yeah, no, it really makes sense. And like, if you get enough, make sure you have enough protein and enough fiber. They're probably like the two secrets to anything when it comes to increasing energy, weight loss, stuff like
Yeah.
that. Definitely.
I
Um,
love the Irish Heart Foundation has this really nice plate model. So your plate should be like half of it should be like colorful fruits and vegetables. And so anything colorful generally is high in fiber as well. So half your plate is colorful fruits and vegetables, and then a quarter is protein, and then a quarter is your high fiber carbohydrates like brown rice, brown pastas, that sort of thing. But it's
mhm.
really good visual for people because I think a lot of people like they have like 50% of their plate, if not more, is their carbohydrates, their pastas. And then
Yeah.
they've got, yeah, some sauce on it. But then there's like vegetables aren't really in that. Whereas if you get your chopper that I'm talking about and you chop up all the vegetables and throw them in, then actually you can really increase up the amount of fruits and vegetables on your plate. My mom was a dietitian, and when I was younger, it was not a dinner unless it had either salad or vegetables or both at the table, and like your plate had to be filled with half of that. She was utterly determined. There was no chopping it up with a little chopper to hide it. It was just like you either ate it or didn't eat it.
Yeah. You had broccoli coming out of your ears, basically.
Exactly, that's it.
Yeah, there's a lot of different things we could talk about with that, but I want to go back to some things that you mentioned earlier that I think would be really helpful for a lot of people, especially around tests. So if someone let's say wanted to just get an idea of where they're at health-wise, but they weren't sure what tests they should take or what they should do, what would you say are like the most important tests that someone should do to get an idea of where their health is at or how good their longevity might be or something like that?
I mean, I think, I do this talk and it's like checklist by age. So I do it by, 20s, 20s to 30s, 30s to 40s, 40s to 50s, 50s, 60s onwards sort of thing. So it does
Mhm.
depend a little bit where you are in your cycle of life, a little bit. But I think really, importantly, when we look at all the, your cardiovascular risk profile is probably the biggest thing. So from a GP point of view, it's blood pressure and then, fasting bloods with a cholesterol check, diabetes checks of fasting sugar, HbA1c, liver and kidneys, because you're doing it. And we do see a lot of liver problems in people now with a fatty liver. So it's where you get fat depositing within the liver. And we used to think that didn't really equate to anything. So we just see it on an ultrasound scan and we just say, oh, it's nothing to worry about. But we actually know now that if you have fat in your liver, that it can change into cirrhotic tissue, so like scarring tissue, like what you would get with people who drink copious amounts of alcohol. And that can actually result in liver failure. Now, not everyone with fatty tissue in their liver, because some of your listeners may have that, is going to go down that path, but it's just really important for it to be monitored. Um, so, if you do a baseline panel full blood count, which gives you check whether you're anemic or not, kidneys, liver, cholesterol, diabetes, and a blood pressure check with that, and then you combine that with a family history, that can be a really good baseline test. There are other tests you can do in terms of more complex, sort of insulin testing and cardiovascular screening and things like that. But I think that's should be advised more on a case by case basis. But those are like the things to get right are the basics, and getting your weight and your blood pressure, cholesterol, and making sure you're not diabetic is really, really important.
Okay, so essentially then, if someone comes into you, the main thing, like you said, depends on age, but basically it's going to be blood pressure and getting bloods done.
Exactly, yeah. So
Yeah.
fasting bloods and then a blood pressure. Your fasting bloods, like your cholesterol goes hand in hand with your blood pressure. So, if you think about it that way, you're always going to do, I'm never going to do a blood pressure without cholesterol, or cholesterol without blood pressure, because the two of them go so hand in hand with each other. So
Hmm.
if you're in your 20s, you might want to do that, like, I don't know, once every, you know, 3 years or 5 years, depending on what your readings have come back as. Like someone who's really fit and healthy and they've had a perfectly normal panel and their cholesterol is really good on that, I would say that's pretty much you for 5 years unless things change. Whereas in your 30s, maybe you want to do it every second year. And then in your 40s, I would be saying every year, which might be a little bit excessive, but I think, I see so many people with high cholesterol in their 30s, and I think we see now that really it's really important to have a normal cholesterol to be addressing your cholesterol from
Yeah.
your 30s. And I chair a meeting in RCSI, the Heart Summit meeting. It's run by the Matter Private. I did it the last 2 years, and like what they're saying is really if you can have normal cholesterol from the age one upwards, that's when your heart's going to be okay. So really they were saying there is no age where it's okay to have a high cholesterol. So really then knowing your cholesterol from a young age is important.
Yeah. Okay, sounds good. And with DEXA scans, what age do you think that would become kind of essential from?
So for women, so the HSE would say women should have a DEXA scan at 60. But the International Menopause Society last year came out and said that women should have a DEXA scan when they go through menopause, so when their periods stopped. And the reason for that is you lose 2 to 3% of your bone density before you go through menopause, so before your periods stop, and then up to 20% within the first 5 years. So if you do a DEXA scan at 60, you could actually be in osteoporosis already. But also, if you do a DEXA scan at 16, you have osteopenia. Well, how fast have you developed that? Is that, has your bone density gone down very slowly over a 10-year period, or has your bone density dramatically dropped in a 2-year period? So I now, I think a lot of stuff, a lot of the public health initiatives that we do are absolutely brilliant, but they're looked at it from the point of view of the population, and it's based on population health and population funding. Whereas it's really important for us as doctors to be looking at it from the individual perspective. So for
Hmm.
me, when someone goes through menopause now, I say to them, let's do a baseline DEXA scan. If that's acceptable to you, if you don't want to do it, that's okay. But it's acceptable for you to do a baseline DEXA scan in menopause, and I think that's a really important thing to do. And I've picked up loads of osteopenia, but even quite a few cases of osteoporosis in women who are sitting in front of me, and I would never have said they look like someone who could be at risk of osteoporosis, because we can, there are certain risk factors for osteoporosis, but they're not
Yeah.
women who I would have thought would be at risk of osteoporosis.
Hmm. Yeah. So going back to basically what you said earlier, that you can enter menopause at any age, really. So don't let your doctor tell you that you're the wrong age or something like that, because if you are someone who's 38 and you have entered it, then it's
Yeah.
going to become critical. It's obviously up to you at the end of the day, but getting a DEXA scan would be beneficial.
Yeah, and people who've gone through premature menopause like that, or premature ovarian insufficiency, we do regular DEXA scans with them as soon as they've been diagnosed, and then regular ones. But other conditions like celiac, if you have celiac, or inflammatory bowel disease, um, what else? There's a few different conditions where we would do earlier DEXA scans and more regular DEXA scans.
Hmm.
So it's a really important one. I think it's one we kind of forget about a lot as GPs, because it's not like in your early years, it's not going to kill you. Do you know what I mean? I think we focus too
Yeah.
much on sometimes on things that will kill you. I mean, you can actually die from hip fractures in your 80s and 90s, because they can be quite serious. So you could argue that that's not true. It's just not at that moment it's going to be a problem. But I think
Yeah.
it's really important. And again, it comes back to that preventative health. Comes back, I suppose, to the having the time to talk to people about these things a
Hmm.
little bit. I think it's really important to have it on your radar.
Yeah, definitely. That's why I wanted to bring it up, because it's so the majority of people that I work with now are mostly between like 40 to 60, but I have worked with a few people who are like in their mid to late 60s. But I've honestly seen a massive difference in terms of how someone has described their quality of life. Um, and some people who are really fit and really strong and really take care of themselves in their 60s have a really high quality of life, and they're doing
Yeah,
lots of traveling and hiking and training 3 times a week and yoga, and they're doing everything under the sun. And
yeah,
then I'll talk to someone who's in like their early 50s or even in mid 40s. They might be 20 years younger than this other person, and
yeah,
their quality of life is significantly worse because they've lost some of their bone density because they haven't prioritized like their fitness or their strength, and that's affecting them their quality of life, so that because that's kind of one of the main things that is a goal or a deep reason why a lot of women that I work with want to make a change, because they want to have really good quality of life and do lots of
yeah,
traveling and have loads of fun and do all the hiking and all that stuff,
yeah, yeah.
so it's
Well,
yeah.
I mean, it just seems like movement is so important. Movement seems to be really, really key. I don't know, did you see that program about super agers on RT? They had a program about super agers who were these, 18, 90-year-olds who were still, dancing and doing yoga and really fit and healthy. And like the thing that came out of that for me was just to keep moving, that you've got to keep moving and that can be, doing a little bit more or doing like a little bit less, but that you need to be, moving and not losing that, that baseline, really important level of fitness.
Yeah,
Um, and that's definitely where someone like you comes in, like, because like, yeah, coming to see your doctor and getting your cholesterol checked is really important. But if you can't get up off the chair and do what you want to do, then what's the point in having a perfect cholesterol? It's not really to your advantage, it's
exactly.
all about that quality of life.
Yeah, and like a lot of people don't realize that you can get really good results literally just training for 30 minutes, like 2 to 3 times a week. That's what everyone that I work with basically does, and we'll do that either between a one-to-one or join some classes, or they might do a recording in their own time. But like 30 minutes 3 times a week, it's 90 minutes in total. If you work that out percentage wise, it's like 1.5% of your
Yeah.
week. I can guarantee you that most people have way more screen time
Yeah.
on phone than they do.
Oh, absolutely. Yeah,
90
definitely, definitely. Yeah. I know I've started incorporating my day more in like 10-minute slots. So I'll do like 10 minutes of like I really like floor pilates or or wall pilates or doing like standing core work and stuff like that. So that's been my way to kind of incorporate it. And then
Nice.
I'm not trying to be like, oh, I'm gonna, for me, I find it hard if I'm trying to dedicate time to something, I find that really hard. Whereas if I just opportunistically take the time and do it, I find that is I'm more likely to do that. I think about someone like you who I had to who was holding me accountable. I think that would make a big difference.
Yeah, the
But um,
accountability definitely makes a big difference for sure. Yeah, I think it's everyone has whatever, yeah, different way that works for them, but what I've found works for me personally and for most people is like having a specific like day or time each week. So
okay,
it could be like, Tuesday morning 8 to 8:30 and Saturday morning 8 to 8:30, or
yeah,
but just finding a time in your schedule that like, okay, I won't be called into work for that, or
yeah,
I won't be busy at this particular time, or I always have a Saturday off, or just having
yeah.
that reoccurring kind of in your calendar, I think is really important. Um, so one of the other things I want to ask, and then we can finish up because we could probably talk all night about so many different things.
You have to.
Um, but I suppose a good one to finish on would be, what would be some of the main recommendations that you would give, let's say, women who are maybe in menopause recently, or maybe just in their 40s and 50s, and they wanted to start to work on their health a little bit more, and they wanted to take a little bit more, put more time or interest into really improving their health as much as they could. Like, what would be like a good first step for someone like that?
I mean, I think a good first step is looking at where you're doing now and then looking at what ideally, you would be doing, comparing that. Because I think sometimes it's easy to have little bad habits slip in and not realizing they're there. So I think, taking a really good look at your exercise regime and writing down, well, realistically, how much exercise am I doing in a week? Writing out like how much food you're eating in a day. And it's really easy to kind of like forget about the biscuit you're having as a snack or that bit of chocolate you're having after dinner. Um, and again with the alcohol as well, how much water you're drinking. I see you drinking water there. Like water is just so important.
Yeah.
Um,
Glass.
yeah, exactly. And looking at all those lifestyle factors, because at the end of the day, if we were hunters and gatherers and cavemen, we'd actually probably be really healthy. We'd, probably get, I don't know, eaten by an animal, but at the same time, we'd be really, we'd probably be really healthy. Um, so, it's looking at that lifestyle factors. Um, and there's so much you can do like yourself, and those factors, like we do know that being healthy, eating a Mediterranean diet, exercising, stopping smoking or not avoiding smoking and reducing alcohol will all help with perimenopausal symptoms. So women who smoke will go into menopause on average 18 months earlier, and they will have much worse menopausal symptoms. So, there's lots of things you can do actually. And that doesn't mean you'll need help, and you should always seek help if you need help around perimenopause and menopause. But there's lots of things you can do yourself at home to make adjustments to make things better. So I think taking a look at that, especially with the weight gain and perimenopause, like I think that's a huge thing. A lot of women coming into me saying, lots of symptoms around perimenopause and menopause, and there's definitely reasons to go on HRT. If that's what you want, and that's you're okay to have HRT. But the HRT isn't going to make you lose weight overnight. It's not a quick fix. And for me, there are all these injectable weight loss medications, and they have their purpose. But I find with a lot of times they have huge side effects. They kind of burn out almost, like they kind of like stop working almost after a little while, and people start gaining their appetite back again, even though their idea is to suppress your appetite. So you do make gains with them. But at the end of the day, there's definitely gonna be stuff you're gonna have to do yourself. And like I find that like a bitter pill to swallow. I find that really hard that I need to be doing things. So I appreciate that's not easy. Um, but I think those are the things that taking those steps and looking at that. And then what we were talking about there in terms of the health screening, like doing your DEXA scans when it's due, doing your smears, checking your breasts at home, doing your breast checks when it comes up at 50, and then doing those blood tests just to check your parameters. But those parameters you could probably almost predict from your, some certain factors like your weight and your height and if you're smoking and those sort of things. So, yes, great getting the bloods done and getting your blood pressure checked, and I definitely advocate for that. But some of that is going to be predictable based on your lifestyle factors as well. So I
Hmm.
think, trying to sit down and, look through it, and, maybe going through it with someone like yourself, but like certainly going through it yourself and then looking at what recommendations are is a really, really a good start. Because also very often you're going to hear that recommendation from somebody, so like you're probably going to hear that person saying, okay, what's your diet like? What's your exercise like? So actually, you can look at that yourself to start off as well.
Yeah, for sure. That sounds really good.
And then
Um,
the only thing to say is just like if you do need help, like get the help when you need it, because I have a lot of women come into me and they've, you know, like unfortunately maybe heard from somebody, oh, it's not menopause, or they've kind of felt like too afraid to come in or too embarrassed to come in. And they come in and it's like a tearful conversation and it's a stressed conversation. And it's like signing people off work for a few weeks while the medication starts to work. And nothing should ever get that bad, and I'm not saying it's that person that's let it get that bad. It's, that they haven't had somewhere to turn to get the help they need. But there is help available. And it's really important to never let things get that bad.
Amazing. So if someone is in that position and they need to get in contact with you, what's the best way to do that?
So I am in Grafton Medical in Grafton Street. So I can see people here. And then as I said, as you introduced in the introduction, I have started the menopause clinic in the Avoca Clinic in Carrickmines. So, and the clinic in Carrickmines is really dedicated to menopause. But here in Grafton Street, I'm a general GP, so I do everything. Men's health too. I've had female patients tell me I'm very a big advocate for men's health, which I am, but I think it's the preventative health person in me. But I see women for all hormonal issues, and I recently started the endometriosis, can't talk anymore, clinic here as well, and that's flying. So anyone can book in to see me there.
Amazing. That's, yeah, really good to hear. So what I'll do is for anyone that does want to get in contact with you, I'll whatever details you want to share, I'll leave them in the caption below. So if you're watching on YouTube, or just go to the description actually, or if you're listening on Spotify or any podcast platform, or on LinkedIn or wherever it is, I'll just pop Louise's details below. And yeah, I think we'll leave it there for today because there's so many other things we could do. So we should definitely do a part two if you're up for it, and we can go through more
Yeah,
specifics. But
perfect.
I'd say that's probably enough for everyone to digest for today. And I really appreciate your time, and it's been amazing to chat. So what I'll do is I'll end the recording here, and then we can chat after.
Perfect. That's great. And thanks for having me on. I've really enjoyed it. And I'm a huge awe of the work you do as well.
Amazing. Thank you. Appreciate it.